COVID-19 pandemic has positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. COVID-19 pandemic has also caused significant changes to homes, working life and stress. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. We have with us Dr. Mahesh D, MD, DM, Endocrinology Consultant, Endocrinology Astus CMI Hospital, Hebel, Bengaluru, Dr. Somnath S, MD, DNB, Consultant Physician, Sanjana Diabetes and Eye Care, Bellary, and Dr. P Singh, Professor and Head Department of Cardiology, Indira Gandhi Institute of Medical Sciences, Patna, Bihar. Thank you all so much, doctors, for joining us on this very important issue. Starting with you first, Dr. Mahesh, what is diabetic ketoacidosis? Do people with diabetes need to worry about DKA post-COVID-19 infection?
We have seen that there is an increasing number of patients with diabetic ketoacidosis after COVID-19 infection also. So diabetic ketoacidosis is a condition in which there is severe insulin deficiency, because of which the glucose levels will increase to such a high extent that it will cause the fat to break down into acid. So diabetic ketoacidosis is there is an increased amount of ketones from the fat breakdown, which will form acid, and this acid will damage the blood cells and mainly cause abdominal pain, breathlessness, severe dehydration, and they may require ICU admission and care. This condition will respond very well to insulin infusion, that is IV injection of insulin and IV fluids, and subsequently with the help of insulin the patients can recover. COVID-19 causes acute stress, and because of it there will be inflammation and insulin requirement will suddenly increase, and those especially who receive steroids are likely to develop ketoacidosis because of the higher requirement, and the body will be insulin deficient. So just monitoring our glucose levels will help us to understand the diabetic ketoacidosis, and the simple tests like urine ketones will detect whether the patient has diabetic ketoacidosis, and appropriate care at the right time will make them recover from this condition.
Absolutely. I think appropriate care at the right time. So monitoring is key. Dr. Somnath, the outbreak of COVID-19 all over the world this year has posed several new challenges to diabetes care. What is the best way forward for post-COVID-19 diabetes care?
See, where we have seen even normoglycemic individuals, where people who didn't have diabetes have come up with highly variable sugars, that is very high sugars, even in the absence of steroid treatment. So we need to look at these people and treat them post-COVID. But we have seen, what we have seen is, the silver lining is that post-COVID, after a brief period of 1 or 2 months, they tend to return to their normal. But what we tend to do is, we give them, since they are not in a position to go out and exercise, we advise them indoor exercise, physical activity indoors, restrict them from access to junk food, give them healthy eating habits, and also advise them about abstaining from alcohol and smoking. This is one part. We are taking COVID forward by concentrating on patients who have gone into the hyperglycemic stage during the COVID situation, and also diabetic patients whose sugars have shot up much beyond their expected levels. And in the second part, what we try to do is, we don't try to use drugs which cause volume depletion, which can lead to ketoacidosis, as my friend Dr. Mahesh was telling. So most of them, the preferred line of treatment post-COVID would be insulin rather than oral drugs for a brief period at least, and then try to put them back on track.
Sure, I think that's a very important point made. Dr. Singh, there are increasing instances of people having encountered fatal heart attacks post-COVID-19. Is it a side effect of COVID-19 infection, or is it a myth that COVID-19 causes a heart attack?
Ambika, you are 100% right. we are finding cases of acute MI in post-MI period. So we have suggested to start COVID care clinic after the acute condition of the COVID care patients. So where one cardiologist could regularly find or physician or diabetes, as my friend Dr. Mahesh and Somnath were telling, and actually, the incidence of acute MI is increased during the index hospitalization. First 1 to 7 days it remains very high and then it goes on decline. However, due to increased anxiety and hypercoagulability, there are chances of acute MI occurring after the discharge from the hospital. So, a post-COVID care clinic where a physician, a cardiologist, a endocrinologist, and neurologist should give a common counseling to these people for being calm and quiet and taking regular medicine as suggested by Mahesh and Somnath of diabetes and other whatever hypertensive medicine they are taking, they should regularly take. That's why we can cut the incidence of acute MI. And one should also check the markers like the IL-6 and the D-dimer. If they are high, the patient should be put on the anticoagulant therapy to reduce the incidence of acute MI, like Rovaroxaban, madam.
Sure. So post-COVID care is very critical. Dr. Mahesh, we have often heard that early detection of diabetes helps to manage the condition better. But many people with type 2 diabetes may have no symptoms at all. In the absence of symptoms, when should a person actually consider themselves for screening of diabetes?
Yes, this is a very important question. We always know that prevention is better than cure, but in diabetes, early detection is better than late treatment. So it is very important that patients or people with family history of diabetes get themselves screened at the age of as early as 25, and those who have a BMI body mass index above 23 to screen themselves at the age of 35. If they have hypertension or if they have PCOD, that is polycystic ovarian disease, or if they have a family history of heart problem, then also we tell them to screen themselves early at the age of 35. Those who don't have any problem are absolutely normal with no family history, they also should screen themselves at the age of 45 for diabetes because it is asymptomatic. It is very important to understand that early detection will reduce the complication rate by 50% in majority of the patients, and that is the reason why we want them to screen early. Early screening does not mean that we want them to start medicines. We want them to prevent starting medicines, and not only that, we also want them to prevent developing complications. The reason why we detect diabetes is not just to bring down the glucose level, but in fact it is to prevent and postpone the complications, so that diabetes is a disease that causes major complications affecting the heart, kidney, brain, and the eyes. We want those complications to be prevented and not just bring down the glucose levels with tablets or insulin. So screening early is very important, and those women who are planning pregnancy should also screen themselves early so that they can have a healthy, normal pregnancy. So screening is to prevent starting medicines and also prevent the complications. And the only treatment that we want the patient to start is diet modification with reduction of carbohydrate, improving the protein intake, and daily walking of at least half an hour a day to ensure that they have a diabetes free life and diabetes complication free life.
I think that's really well explained. Thank you so much. Dr. Somnath, people are still apprehensive about going to the hospitals or labs for routine blood checks and seem to be preferring home blood glucose monitoring systems for diabetes tracking. Tell us how accurate is home monitoring for blood glucose, and is there any need to do an HbA1c test if a person is monitoring blood glucose at home as well?
Yes, Ambika, it's hemoglucometer is a very convenient way of testing. I can understand people not opting to go to labs or hospitals in this COVID era where they feel that they're exposed to a higher risk in a medical center. So what I suggest is hemoglucometer cannot be a substitute for a lab test because lab tests are more accurate, but it is a very convenient way of testing. And hemoglucometer test, it gives sugar values at that point of time when we are checking it out. But hemoglobin HbA1c, which is a test which gives the control of sugar over a period of time. So that is more useful. So you cannot equate HbA1c with a hemoglucometer. But in these circumstances, a hemoglucometer which can give 95% accuracy as compared to the lab test, that is 15 plus or minus 15% compared to the lab test, 95% of the times then you can take it as a very reliable hemoglucometer. So it can be used. It can be used as a substitute in these conditions. But I can assure you that HbA1c is also needed because just a hemoglucometer test, more, however frequently you do it, cannot be a substitute because the long-term control can only be assessed by HbA1c. So
Okay.
this is the main thing. So HbA1c, you cannot substitute a hemoglucometer by HbA1c and just keep on doing hemoglucometer test. So it can be done, but do not substitute. You complement HbA1c along with hemoglucometer for better control of diabetes and to bring down complications.
That's a very important point. Regular blood checkups and along, I mean, like you very well put it, we need to do the blood glucose regularly, but it cannot be a substitute. HbA1c also needs to be done. So on that note, we're going to be taking a short break. We'll be right back. Welcome back. You're watching Beat Diabetes Myths versus Facts. Starting with you, Dr. Singh, as shown in many movies and television shows, most people believe that only symptom of a heart attack is severe chest pain. So, can you tell us what are the other symptoms of a heart attack?
Chest pain is definitely the predominant symptom, but one should know that other presentation can be. Diabetics particularly, they are known for having silent MI. Acute shortness of breath may be the one presentation, palpitation may be the one presentation, increased speaking, difficulty in breathing, pain in the jaw, pain in the back, or the retroesternal burning, epigastric discomfort are not to be ignored on account of this is only the gas, wind fluctuance and dyspepsia. So it can be varied presentation, protein manifestation, anything related with like chest pain, shortness of breath, palpitation, epigastric discomfort, and if it is associated with worsening of the symptoms with exertion or simple walking or little bit of work, one should be cautious of that disease, symptom of heart attack. One should consult his cardiologist, get an ECG done, echo done, other markers like TROP-T and TROP-I should be measured to rule out the acute MI.
Okay, I think that's really well explained. We need to really understand the symptoms and not let go of anything. I mean, visit a doctor. Dr. Mahesh, it's a common myth again that only overweight individuals will actually develop diabetes. Are skinny people immune to type 2 diabetes?
Yeah, it's a very important question, and we are realizing that there are two aspects to this. One is what is obesity? Obesity is not defined just by having BMI more than 30 when we compare to the Western world. In India, we see that the BMI of 23 is also considered to be overweight, which means that they have predominantly abdominal fat, which can give the appearance of a person who is like a lean person, but their fat content around the belly can be very high. Therefore, in India, we consider women having waist circumference more than 80 and men having waist circumference more than 90 as having metabolic risk. But we also know that type 2 diabetes, there are 4 types. One is where there is severe insulin resistance, other is where there is relative insulin deficiency, and other forms of lean and age-related diabetes. So around 30% of the people with type 2 diabetes may not have obesity at all. So we should not ignore that our weight is normal, therefore I need not check my glucose level. I am okay, so what is the point of getting screened? So that myth is gone. Being just an Indian or Asian, the risk of diabetes is very high, almost 2 times compared to any Western population for a corresponding age. And we have also seen that the onset of diabetes and heart diseases is actually 10 years earlier than the Caucasian population. Therefore, just because you are lean and you feel that, I'm not overweight, therefore I need not screen myself, may result in directly, you are getting the complication and then detecting that you have diabetes. And these complications can be asymptomatic, like Dr. Singh just described. In diabetes, many patients may have atypical symptoms. Therefore, they may develop the complications and then detect diabetes. It is very important that at a particular age, if you have a family history, go get yourself screened. And if you are healthy, you are apparently healthy also, at the age of 45, you have to get yourself screened, irrespective of whether you are lean or obese, to ensure that you detect diabetes early or you detect pre-diabetes early, so that you can postpone the starting of medicines and prevent the complications at the same time.
So I think screening here, what you're trying to say is very important, timely screening and intervention. Dr. Somnath, diabetes management is a lifelong process. This includes achieving a delicate balance between lifestyle management and medication. Can you please elaborate as to the ideal balance between the two that should be targeted by people with diabetes? How does one really manage this?
Yeah, if you ask any endocrinologist or a physician treating diabetes, one would say one would not start any medication straight away. They would opt for lifestyle modification, which includes diet modification and exercise and physical activity. So from here, what I suggest is initially when we have patients who are in pre-diabetic state or patients who are in the mild state, we always advise them to go for lifestyle changes like advising them on the right diet and also the physical activity they have to undertake in a specified period of time and not exerting themselves too much. So that's where the catch comes in. So once a patient is diabetic, even with, in spite of all these efforts, we are not able to bring down the sugars to the required level, to the target level, then we also add medications. So even the medications which we advise are mild ones initially, so that we complement diet and exercise along with the tablets. Or initially the milder ones are added, and then the least side effect, the drugs with least side effects are chosen. And so we need to find a balance somewhere. We should advise the patients effectively on how to modify their diet and make it a part of their life. Then rather than keeping it as a one-time event or having it for a week or 10 days or a month or so.
Yeah.
They have to realize that it is over a lifelong, they have to have this over their over a longer period of time rather than cutting short.
Sure.
Then also the exercise. They need to exercise to a level where they can bring down the diabetic medications even if they are on drugs, so that the requirement of the drugs can be brought down. So here we have to balance somewhere. So the ideal balance is optimal exercise, right diet, and least medications. That would be the triad, which can bring diabetes and which would be more effective in treating the patients and keeping them happy with less side effects.
Sure, I think, yeah, optimal exercise, the right kind of food and least medication. And of course, I think the patient needs to understand that they need to manage this for a longer period of time. Dr. Singh, how important is it to manage hypertension to reduce the risk of heart disease? What advice can you share for better management of hypertension?
Hypertension is a silent killer of the humanity. And one famous thing about it is popular rule of one third. Only one third of the people who are suffering from hypertension are aware that they are suffering from hypertension. And only one third of the people who are aware of that they are having hypertension are being prescribed medicine. And only one third of the people who are prescribed medicine are controlled. So you can understand how the dynamic, big population, one third of the total world, our Indian population more, like 34-35% adult population are hypertensive. And hypertension is a silent killer. It is a risk factor for the increased MI, increased coronary artery disease, heart failure like thing. So if you control the blood pressure, you will be reducing the coronary artery disease by 16%, peripheral vascular disease by 21%, cerebral stroke by 31%, and acute MI by 24%. Significant reduction we can do if we control the hypertension to a desired level. One should know in diabetes, it has to be brought down to a lower down level. Below 130/80, it should be kept one. And all the places where it is possible, it should be kept below 130/80.
Thank you so much, doctors, for joining us on this very critical issue. So what we've really understood is that screening timely is very, very important. Early detection is important. And managing diabetes is key, whether it's eating the right kind of food, walking, exercising daily, and also having your medications on time and checking your blood sugar levels. Thank you all so much for watching.